Hi, welcome. My name is Grace Evans and I am the speech language pathologist on your CLEF team. I'm here to make feeding as safe, efficient, and comfortable as possible for you and your baby. Feeding can be one of the most stressful parts of caring for a baby with a cleft, but you're doing a wonderful job bringing your baby here and asking for help. Before we start, I'd just like to ask you a few questions about your baby's feeding. How long does it usually take to feed your baby? What bottle and nipple are you using right now? Do you notice your baby coughing, gagging, or milk coming out of their nose? How's your baby's weight gain going so far? Thank you for sharing that. Ideally, a feeding should take about 20 to 30 minutes. If it goes past that, babies actually burn more energy trying to eat than they're able to take in from the milk. That's not anyone's fault. It's just because of the cleft and how hard your baby has to work. Let's do a feeding together. I'll watch first, and then I'll make some suggestions. So right now what I want to do is observe quietly, time how long it's taking the baby to feed, watch for compression, tongue movement, coughing, nasal regurgitation, and signs of stress. All right. I can see how hard both of you are working. Your baby is making sucking movements, but because of the cleft palate, they can't make a full suction. What we want to do is help the milk flow with less effort on her part. Here's a few things that we can try. First, let's hold her more upright, about a 60 to 90 degree angle. That way, gravity helps and it reduces the milk coming out of her nose. We can also try some pacing techniques. Let her suck a few times, then tip the bottle back slightly to pause the flow so that she can breathe and swallow. There are some different bottle options. With the Mead Johnson nurser, like you're using, you can gently squeeze the bottle when you see her making a sucking motion. That gives her milk without her needing strong suction. If this bottle still kind of feels difficult for you, there are lots of other options we can try. We can try the Haberman or Dr. Brown's specialty nipples, along with lots of other options. Now let's try it together. You feed and I'll coach you as you're doing it. Great job. See how she's taking milk a little more smoothly now? She looks calmer and she's not working quite as hard. That's what we're aiming for. Efficient, comfortable feeding within about 20 to 30 minutes. Now I kind of just want to go over some frequently asked questions when it comes to feeding. So first one, my baby sometimes coughs and milk comes out of her nose. Is that dangerous? That's very common with the cleft palate. It's not dangerous as long as she clears it and is breathing comfortably. Keeping her upright and giving little breaks will help. If she ever turns blue, stops breathing, or can't clear the milk, that would be an emergency. But a little nasal regurgitation is expected. Question number 2. I really wanted to breastfeed. Am I failing her by using a bottle? You are absolutely not failing her. With a cleft palate, direct breastfeeding simply isn't possible just because of the anatomy. But giving her your milk, whether pumped or formula, through a specialty bottle is exactly what she needs to grow and thrive. What matters most is that she's nourished, safe, and loved, and you're already giving that to her. And last question, how do I know she's getting enough milk? The best signs are steady weight gain, finishing feeds in 20 to 30 minutes, and having plenty of wet diapers. Your pediatrician will monitor her weight closely. You don't need to figure this out alone. We'll support you and adjust as needed. You've done such a great job today. Feeding a baby with a cleft is not easy, and you handled it with so much care and patience. We found a bottle and a technique that makes feeding her smoother and less tiring for both of you. Keep aiming for 20 to 30 minutes per feed, hold her upright, and watch her cues. You'll become more confident every day. You're doing an amazing job, and your baby is very lucky to have you. Thank you.